It says, it says here that I cannot share the screen when somebody else is sharing their screen.
Yeah, I'll have to stop my share. So if you're ready to go, I can totally do that. I can go to, let me see.
Okay, you know what I'm gonna do? I'm gonna send it to you just so we don't have any problems with the sharing.
Okay.
Okay, well, I'll let you start. And I'll
Okay.
send it to you in the meantime.
Okay. Sounds great. Are we recording? Are we ready to go?
Okay, great.
Okay, great. Alrighty, so welcome everybody to the September virtual office hours. Hope you all are having a great day. Let me see if I can figure out how to advance my slides here. Oh, perfect, we got it now. Alrighty. Alrighty, so today we have Ms. Pat Thompson-Reid here from the Division of Diabetes Translation, the Centers for Disease Control and Prevention. We're very excited to have her. So Ms. Thompson-Reid has worked in the field of public health for over 40 years. Her experience spans several decades and includes her current role in the Division of Diabetes Translation. And she serves as a community interventionist and program development consultant. In this role, she developed and implemented Diabetes Today, which is a framework for the planning and development of community-based programs for persons with diabetes. And she trained DDT's grantees nationwide, co-edited the monograph on diabetes and women's health across the life stages, a public health perspective. And she also served as team leader for the National Diabetes Women's Health Initiative. She recently served as the project officer for the Appalachian Diabetes Control and Translation Project, the CDC, and is currently a member of the Island Jurisdiction Team, providing technical assistance to the US territories and jurisdictions in the Pacific and the Caribbean. So I can stop my share now, and if you just want to put your slides on, we should be good to go. You should be able to screen share if you want to do that now.
I think Miss Pat is frozen.
Oh, is it frozen on my screen?
She's frozen on my screen. Okay.
She just sent me her slides too, so maybe I can pull them up just in case.
Yes, because she might be having some connectivity issues as well.
Yeah.
Well, while we're waiting, does anyone have any good news or program updates that they would like to share? No good news? We are a sad bunch of folks. Nobody has any good news or anything, uplifting, anything you want to share about your programs, anything. Sheila, yes, anything. But you're muted.
Of course, I'm muted. I bet Mary Beth has started her drumming activity. That would be good news. I hope that Mary Beth, that you've got that all worked out and it's going well.
Well, I haven't actually gotten started yet, but we are in the process. I got my materials in last week to get started. So of course they're not allowing me to do anything in person. So once we do, it will be online like our gentle chair yoga. So we're working out the bugs, but we're getting there.
All right, good. Well, your video looked really good. So
thank you.
Oh, that's perfect.
Yeah, well, I'm trying to learn how to loop my music. Kevin got back with me, but I'd actually already figured it out. But we're getting there. It's just a slow process. So keep your eyes and ears open.
We will.
Okay. Thank you.
Shirley, did I hear you say something?
Hello.
Hi, Shirley.
It's just so rare I'm here. I'm just glad to see everybody. I'm on vacation this week, so I was able to come in.
Well, good. I'm glad. I hope you're having a restful vacation.
Thank you.
And forgive me, but I have someone on here. I don't recognize the name. It just says Johnson. I don't know who that is. I was just going to write your name down, but I didn't know what county you were from.
And for the folks who are just joining us, this is the virtual office hours with the Appalachian Diabetes Network. We have a guest speaker, Mrs. Pat Thompson-Reid from the CDC. However, she got disconnected. So we are waiting for her to rejoin us, and hopefully she'll rejoin shortly. And today's topic will be on funding opportunities available for coalitions and community-based organizations in the Appalachian region. So while we're waiting for Mrs. Pat Thompson-Reid to join us, we're just doing an open floor sharing. Yeah.
All right, I am back again. I'm hoping this doesn't happen.
Yay.
I just got off. Sierra, did you get the
Yes, I do have the slides. So do you want me to share them, or you should be
I
able
want
to?
you to share them because I don't want this to happen again.
Okay, sounds great. I can do that. Give me 1 second. Let me make sure I have them in presentation mode here. I should probably know how to do this, but does anybody know how to present a PDF file?
Well, it should open.
Yeah,
Let me see if I can pull up mine then.
Oh, I found it now. Okay, I am
Okay.
good to go. Thank you.
Okay.
There we are. Okay, you are good to go. And if you just want to tell me what you want me to go to the next slide.
Next slide. Yes.
Okay.
Okay. I just have to put this on all my slides. So this is because it has not gone through clearance. Okay, so I know many of you are very much interested in getting funding. And I think I discussed this earlier, that it's really important for your coalitions to think about who they are, what they want to do, and what they can do. So the first thing I want coalition members to do is to sit down with your coalition and answer the following questions. What is the current focus of your coalition? I know most of you have been focused on diabetes, but some of you have done other things, which is great. And so I want you to really sit down with your coalition members and think about what is the current focus of your coalition. And if you have a mission statement, where is it that you'd like to go in the next 10 years? Because it's really important to be able to start thinking about that now so you can plan. What would you like to do to improve the lives of the people in your community? It's really important to have an idea or vision. Whoever the leader of the coalition is, they should have a vision and they should share that. They should share that with all the members of the coalition so that you can actually sit down and have a discussion. What kind of resources do you need to achieve this vision? Once you've decided, well, what do we want to do? What is our focus now? What do we really want to do in our community? And what kind of resources do I need? Do I need advice? Do I need money? What do I really need to achieve this vision? The other question I really want you to sit down and think about is, do folks in your community know about your coalition? Or is it just the people that you talk to every day? You're more likely to get funding if people know who you are and what you're doing. So think about that question. Do folks in your community know about your coalition? And do you have a structure, bylaws, officers? In other words, if someone has heard about the coalition, you meet someone at a county fair and they want to know more about it. Do you have a structure? Do you have a president, a vice president, a secretary, a treasurer? Do you have bylaws? Do you have any other officers? And you could say, well, you need to get in touch with the president. You can say, I'm the president of the coalition. What it is that, is there anything like that you'd like to know about what we're doing and what we've done in the past? So it's really important for you to have some kind of structure. What have you done in the past to help your community? Because again, if you're telling somebody that this is the health or the diabetes coalition, then they want to know, what have you done? What did you do? I've never really heard of your coalition. What have you done before? What have you done in the community? And then it'd be good for you to be able to run this off really quickly. And of course, the last thing on this particular page, have you documented your activities? Are there any articles, anything in the newspaper, any newsletter that you've developed, coalition reports that you have written, or maybe somebody else has written? Have you spoken at events? Do you have any social media clips that you can share? Because it'd be good if you could just pull something out. You never know who you'll meet somewhere. And you can just pull it up on your phone and say, well, this is what we've done, and pull it up on Facebook, and they could see something about your coalition. It's really important to have those things documented somewhere. Next slide. So we've been funding the coalitions now for 20 years. And so one of the things that I find that people sometimes don't understand, and I myself don't even realize it, you know more than you think you know. And so I'm just bringing this diagram up, so you can think about the kinds of things you've done over the past 20 years or whatever number of years that you've been involved in the coalition. Now, at the community level, you have insurers, employers, informed population. I'm sure many of you have done a lot to inform the populations that you work with. You have helped to develop strong community organizations, whether it's your church or the health committee in your church. Have you influenced healthy public policy in your community? Have you also helped to build supportive environments? I know several coalitions have built tracks around their school, or they have walking trails. What kind of supportive environments have you built over the last 10 years or supported over the last 10 years? So I think a lot of times you're not thinking, maybe you were part of it, but you're not really documenting some of the things that you have done or have achieved over the last 10 to 15 years. And I want you to really sit down with your coalitions and think about that. Have you worked with employers? Have you gone to a site, an employer invited you to come and talk about diabetes or talk about the diabetes prevention program? Maybe you visited a work site and made a presentation. This is why I'm saying you need to be able to document what you've done and how successful it was. Now, within the partnership zone, most of you probably weren't involved in the reimbursement unless you're in a health department. but I'm sure you have either referred people to be screened for diabetes or other diseases. And those of you who worked in the primary prevention program, you have probably referred people for the diagnosis of prediabetes, either to the local health department or to a local hospital or clinic. This blue zone, this light blue zone, is a really good way to partner. And it's a good place for coalitions to partner with other organizations. Now, the dark blue zone are probably things that you have not been involved in, but there are certainly areas that you should be knowledgeable of. You should know who the practice team is at your hospital or clinic. They are the ones who actually decide what to do to improve the outcomes for persons with diabetes who come to them for services. Are there information systems in place to either document what you've done or even to document the number of persons with diabetes or with prediabetes? And are you providing information to patients, or is the healthcare system doing these things? So the dark blue on the outer side of this egg is really what your health system should be doing. The middle one is where you can actually partner. And the ones on the outside and the light blue, the ones on the furthest left, are some of the things that you're probably doing now. Next slide. So think about what you've learned over the years as a part of this network. And I'm sure one of the things, number one, is sharing of lessons learned with other coalitions. We've had several meetings, every 18 months we've had meetings, and now you have these meetings, these once a month video calls, Zoom meetings where you share ideas. I think it's really important for you to think about some of the lessons that you've learned from other coalitions that you might want to apply to your coalition. It's something that it's one of the good things about being a part of the network. And we certainly did try to accommodate that over the years. What does your coalition do best? Or what are you best at? What do you do best? What are you good at doing? Now, I know some coalitions did things like health fairs. Now, to organize a health fair, you have to have good organizational skills. Are you good at implementing health fairs in local communities? That's a skill that a lot of people would love to use or to make use of. And I know that several of the coalitions have done this. You could develop a business around that. How are you at keeping coalition members engaged and activated? I know that over the years, one of the issues and one of the problems that you've had is actually keeping the coalitions activated and engaged. And so what did you do to overcome this issue? You need to really think about that and write some of these things down. What about recruitment of new coalition members? Maybe after you really sit down and talk to your coalition members about what it is that you really want to do, you may decide, you know what, we need to recruit some new members. Because in order to achieve what I'm thinking about right now, I need some new coalition members. And so you actively go about and you recruit those people. Because if you do want to go for a grant, you need to have partners. You need to have partners who can help you achieve the things that you say you want to achieve. It's very hard for you to do this alone, okay? Have you been able to get policymakers involved? That's something you need to really think about. It's really a good idea to have a policymaker, a member of your coalition. They don't have to come to every meeting, but you want to make sure that they're on the list and you can call on them whenever you need help, or maybe you just need some advice on where to get funding. So it's so important for you to try to get a policymaker involved. And because your communities are small, you probably know quite a bit of the policymakers in your community. But get them involved, get them involved, get them to make a commitment to help you. They know a lot about funding. They know a lot about funding that's coming down the line in their county. You know, there's so many places you can go to get money to actually do what you need to do. And of course, that speaks again to getting resources for sustainability of coalition activities. Next slide. Okay, so let's say you've done all of that, you've documented all the things you've done, you know what you do well, you have people, you have a coalition that represents not just the people that you know, but people from other parts of the community that can help you set an agenda or even help you to get resources for your coalition. Now, what kind of organization do you represent? That's also something that you need to figure out. Are you just going to remain a coalition for the rest? You know, you just decide, well, you know what, I just want to be supportive. I don't really want to do my own thing. I don't want to be an independent organization, and that's fine. But what you might want to consider is, do I want to be a nonprofit organization? Do I want to be a for-profit organization? All those things are important because it helps you to decide where to go for funding. Then, what is your area of interest? Right now, many of you are involved in health. Are you interested in transportation? Are you interested in food insecurity? Are you interested in mental health? These are just examples. Are you interested in housing? Are you interested in substance use? Are you interested in arts and recreation? You know, these are all areas that would supplement whatever it is that you want to, that's in your mission statement. Now, we're beginning to get to the meat of the matter. Who are your potential funding partners? If you are just going to be a coalition, you can get some funding from foundations, but it'll be small amounts. But if you decide you're going to get your 501c3, then that's another matter, because then you actually can receive the funding. But if you want really larger amounts of funding, you need to think who are potential funding partners. Right now, you're working with Marshall University. And that's a really good thing, because Marshall could be the recipient of large amounts of funding for the coalitions. You already have a good funding partner in place. Most people don't have those connections. But you still need to think about, what do you want to do and what can you do best? Can you just be supportive of, say, a funding that comes from Marshall or from your church or some other organization, or are you going to do this on your own, and what can you do best? What population do you want to focus your effort on? That's something else you need to think about. Are you going to focus on adults? Do you want to do something with preschool or with infants? Do you want to work with women, pregnant women? Do you want to work with school-age children? You know, a lot of times, from what I recall, many of our coalitions are involved with several different projects. Some are involved with school-age children. Some are involved with the elderly. But if you're going to seek funding and serious funding, you need to really define the population that you want to work with and collect data on that population. Because this will help guide you to where you would go for funding. There's so many different organizations, and it's so important to focus, begin to focus, not just doing everything everywhere. If you want to focus on adults, this you can say, well, this is what I want to do. If I want to focus on maternal and child health, this is what I want to do. I really want to focus on women with gestational diabetes because they end up having kids with diabetes because they don't lose the weight after they have their babies. Do I want to focus on school-age children? Because I would then focus on the schools. And maybe where I'd go to get funds is the Department of Education. Do I want to focus on college-age students? Maybe I want to do a tuition, or I want to go to an organization that will fund a program that helps people in college to graduate. Maybe I want to deal with the elderly, you know. There's so many different iterations that you can focus on, but you and your coalition members really need to sit down and think about that and come to some consensus. Now, you can still do all these other little things at the community level, but your overall mission is to, at some point in the growth of your coalition, to focus your efforts on a particular age group or a particular population. Next slide. Okay. Funding sources. There's so many funding sources. Your local government gives away money. You know, people give grants and contracts out because that is a way for government to fund ideas and projects that provide services and stimulate the economy. There's a reason why people give out grants. You know, they help you to realize your goals and objectives, but at the same time, you're providing a service. And in the end, it helps to stimulate the economy in the United States in general. So local and state governments are really a way to start. And I remember we had a meeting here about 2 or 3 years ago where I brought the people from the state to meet with the coalitions in the states so they can make a connection. Several times we fund the states, but we also encourage them to provide funding to local organizations. But if there's no connection between the state and the local level, it's very hard for you to make those, to get the resources that are available. So local and state government is a place to start. You know, go to their website, find out what's happening there and what kinds of opportunities might be available to you. Having someone on your coalition that knows or has this information is a head start, because they already know what's coming up and they can give you a heads up. Listen, we're going to be putting out this grant next month or 2 months down the line that's focused on children of mothers who had gestational diabetes. Or there's this grant that's coming up to help people who have been incarcerated to re-enter the community. Maybe you guys could think about how you'd want to do that. And they would already know what you want to do. So they'll be able to share that information with you. The other place that I want you all to go and look at is the Federal Registry. It has lots of opportunities in there. Everything that goes on in the government is published in this registry. Could you click on one of these links so we can go see what the latest one is saying? No, yeah, the Federal Registry link. Can you click on, are you connected to the internet?
Yeah, I'll just have to stop the share really quick, but I can go to the page real quick.
No, well, you can click on it's live, the link is live. So you could stay on the presentation, just click on the link.
Yes, I've got it right here. Sorry, when I was in presentation mode, it wouldn't let me click on the
Oh,
link.
all right, okay.
Share.
I'm telling you, is anyone in the audience familiar with the Federal Registry? It's a really great place to go and get information about the government and opportunities.
This is Regina. I've heard about it before, but I wasn't aware that they had like their current funding opportunities on there. So do they have like
everything that happens in the government is in this, and they publish it at a time. Now, Sierra, could you go down a little bit just to show people what's in there?
Mm-hmm.
Okay, so here's one opportunity. To become an Office of Women's Health Self-Measured Blood Pressure Program partner. It doesn't provide you with any money, but this is something that I'm thinking a couple of organizations could apply for. And basically what you're doing is promoting blood pressure measurement among women in your community. Okay, so keep going down. So it gives you the dates that you should submit your letter and where to submit them. Okay, keep going. So this is just one thing. It talks about the whole vaccine. I think this was before. Could you go back up, Sierra? Anyway, oh, all right. Well, what you need to do is, I only put a few pages up there because I didn't want it to take up the whole, use a lot of my because when you do the presentation, if it has too much in it, it won't function. But I have the link there, and I think it's really important for you to become familiar with the Federal Register. All potential funding is there. Other opportunities are there. Okay, go down a little bit, Sierra, if you can. Let's see if we can at least go down. We might not be able to go up, but maybe we can go down a little bit more. Okay, so it announces everything that's happening in government. So if there is a new NOFO that's coming out at CDC, it'll be announced here, and it'll tell you when it'll be announced. It also gives you announcement for making comment on something, you know. So become familiar with this website. It's a heads up website, and it gives you opportunities to participate in activities that are being sponsored by the government, the federal government. All right. Okay, so take note of the site and go check it out. It's really a good place to get information. So let's go back to the, okay. The second one that I want you to be aware of on the federal grants, the next one, can you go to that one, that site too? Okay. Every grant that comes out from the federal government, from all the departments of the government, is on this site. So that's why it's so important for you to decide what your target population is going to be, because, okay, if you want to do something with women and children, it might be best for you to go to HRSA because that's what they focus on. But could you click on grantors, Sierra? Okay. Go back to grantors. Don't click on the first link yet. Grantor facts. Yeah. Now this tells you all about the different grantors. Okay, go back over to Learn Grants. Go to Learn Grants and go to grant programs or grant making agencies. Yeah. Now, do you see all the agencies that are, if you're interested in agriculture, you would go there. If you're interested in Department of Education, you go there. If you're interested in CDC, you would go to Department of Human Health and Human Services. If you're interested in working with, say, the people from Afghanistan or, anything that have to go do with migration or whatever, you would go to Homeland Security. If you're interested in looking at grants that has to do with housing, you would go to the U.S. Department of Housing and Urban Affairs, Department of Labor, all of the various organizations, the National Science Foundation, the small business. If you're interested in setting up a business instead of a nonprofit, then you would probably want to go to the SBA. So all of it is on this particular site, and this is where they announce their grants. And so it's too much for you to be going to look at all of them at one time. That's why it's so important for you to prioritize and decide where do you want to focus your energy? What population would you want to focus on? So then it would guide you to look at whatever funding agency might be able to provide you with funds to do the work that you want to do. If you're interested in food insecurity, you might want to go to the U.S. Department of Agriculture, okay? Because they are the ones who would fund that. If you're interested in doing parks and recreation, you might want to go to the U.S. Department of the Interior, which is the DOI. So these are places that are on the internet that provide resources to people to develop public health service projects that would serve their community. AmeriCorps is a really good place to find out about grants as well. Now, if you're interested in international health, then you go to USAID, but I think most of you are interested in doing work in the United States. But could you go back to the top again, Sierra? If you want, you have Grants 101. That tells you a lot about what federal grants do, what the grant cycle is, and the different phases that you would go through if you apply for a grant. And so then it also, there's a section on grant eligibility, am I eligible to apply? So for each grant, it tells you in the NOFO or the Notice of Award, what the eligibility is. Most federal grants are not for individuals unless you're applying for like a student loan or something of that sort. But most federal grants are to go to organizations. All right. So I would suggest that you go through Grants 101 and read through some of these. It's not that long. It's good for you to be familiar, especially if you're looking for grants from the federal government. And I'm telling you, even at the local level, it's not that different. The terminology, the life cycle, it's very similar. Okay, let's go back to the top. Let me see if there's anything else I want you to look at. You know, there's a support link. So if you're having problems, you know, even navigating the site, and there's a section for applicants. Go back to applicants, Sierra. It tells you how to apply for grants and how to register if there's need for training. It's really a good site for you to become familiar with if you want to apply for a grant. All right, let's move on to the next slide.
Sorry, I clicked off, so I have to go back to it. Give me 1 moment.
Now, I know most of you are familiar with the Appalachian Regional Commission. That's how we funded the coalition. CDC provided funding to the ARC, and the ARC matched that amount, and then they distributed that money to Marshall University. So I've also given you this site because I think it's important for you to be aware of the grants that are now being supported by the ARC. Now, Sierra, could you click on that? So Congress gives ARC funds, and these funds are being invested in the Appalachian region's economic and community development efforts. So, I mean, I think it's really good to maybe look at this to see whether or not you would want to follow up on applying for any of these grants. And I've given you the links because I think it's really important for you to go and look at what is available. Any questions about any of this? Okay, let's go back to the next link. Community foundations. Let's click on that link. Now, there are several community foundations, and they have, I was looking at the ones for Appalachia. You know, you can click on all, you could enlarge the map and click on the foundations there, and you'll get information about them. The other thing is, and I'm not, you might think I'm crazy, but you could become a foundation. You know, a coalition might decide, well, you know what? We're concerned about the fact that there are people here who can't even afford the diabetes drugs. I would like to be able to help these people. You might start off doing a GoFund thing, and you could invest that money, and you could add to that. You can do local community events to raise money to add to that. And so you might be able to have like $5,000 to $10,000 every year that you could distribute to people in your community. But this is where you would go to become a legitimate foundation, because people are willing to give you money only if you have this certification. Most people will give money if they know they can deduct it from their IRS on their, you know, if they can deduct the amount that you have given them from the IRS. So and on their, what is it? that we
Their
all-
taxes,
Yes.
taxes, yeah.
Right, they can deduct that from their taxes. But in order for you to become a foundation, you have to go through certain steps. And this gives you the steps that you go through. All right. But I can envision that. So you start with your assessment, getting accredited, what you need to do, and the program. So they set standards for community foundations. And it's, there's nothing wrong with thinking about doing something like this at some point in the life of the coalition. This might be something you want to do. And it means that you're taking steps along the way to raise the funds so that you can eventually be able to give the funds to people in your community. And you would have to also think about, well, how do I sustain these funds? And you may have a nonprofit, or you may have a for-profit organization that would, donate money to the foundation, and then you would have those funds to give away. So there's a lot that you can do, but it's important to have the information. Next one. So this also helps you to locate where the foundations are, in addition to getting accredited as a foundation if you want to move in that direction. And there's nothing wrong with that. So there are also national organizations such as NACDD, that is the National Association of Chronic Disease Directors. They also fund organizations. ASTO and NACHO, they work at the community, at the local level, but they're also a national organization, and they also have funding. One of the really big foundations is the Robert Wood Johnson Foundation. And I just want you to go to their website, but I just clicked on one opportunity that they have now. When you go to the Robert Wood Johnson Foundation, they have several opportunities, but I just clicked on this because this talks about people, parks, and power. And I know that there's a lot of opportunity in Appalachia to develop parks and to develop your green space. So I think this is something that you could probably look at. It talks about health equity and that is something that we really need to think about. And I really feel that you need to go to the RWJ and look at what they have. Now, something like this, you would want to probably talk to or have discussions with Marshall about, because the amount that they give is pretty large. So you would have to have an organization who could handle those funds. But there are lots of opportunities out there. Okay, so let's go back. So yeah, is that the end? I think so. So this is the end of my presentation. I'm going to open it up for you to ask questions. I'm also going to go to the chat and look at some of the questions that are in the chat. Sierra, any questions from anyone? Let me look at the chat. Okay, so.
No questions yet. There are just a couple of comments in the chat, but if anyone has any questions, please feel free to unmute yourself.
Yes, please, and go ahead and let's have a discussion. We still have, we only have 7 minutes. Okay, we still have 7 minutes.
Pat, Janice asked if we could share your slides. We do record
Yes.
these. Okay.
Yes, you can. Please share the slides because they have all the links in it. And I think that's the purpose. That's the main purpose, is to get the information out. Even here at Marshall, many of the other departments are not familiar with our division, what we do. So, Marshall, so Regina, you need to maybe get some of the work of the coalition in a newsletter that you distribute throughout Marshall.
Yes, in fact, we do. We try to highlight some of the work that that our coalitions do. We put it in the regional newsletter.
Very good. And please, coalition members, find somebody that you know at the newspaper who will write an article about what your coalition did over the weekend. You know, it's always good to know someone who's a journalist who works for the local newspaper, because they're always looking for something to write about. And that's something you could use later on, you know.
Yeah, I have an add-on about that. When I lived in Hale County, Alabama, I used to send things to the editor because it was really small, and he used to just print whatever I sent to him, like the entire article. So a lot of small counties, they need content for their newspaper. So if you can get somebody's email address, and every time you have an announcement, just add the editor's email to your listserv.
Yes, they're always looking for information to write in their newspaper. And the more information in the newspaper, the more people will want to read it. You know, people want to know what's going on in their community. So I think it's important for the coalition to have a contact at the local newspaper and for local radio station too.
As well as TV, Pat, as too. We've had several of our coalitions actually reach out to a news station, and they've come, you know, they've come and covered the event, you know, talked to the coordinator, the whole thing. Yeah, just recently, in fact, I believe Mingo County, West Virginia, was covered on one of their news stations.
Yeah, any media, just get to know the people out there. Get to know the people. Because if you ever get some money, you definitely want people to know what you're doing, because that'll just help you to get more money later on and more support later on. Okay, so someone said something. Oh, Sheila, the importance of targeting your population that you want to work on. It's so important because everybody's going to come to you. I want you, could you do this? Can you do that? Could you do that? Especially if they know that you do well, if you work well with the people. But you cannot work with everybody. You cannot do everything, because then you're going to be stretched too thin. So it's good to have a mission statement of some sort or some guide for your coalition, because many of people who work on these coalitions have other jobs. And so you can't have them doing everything and everything that everybody asks them to do. It's really good if they can focus and say, yeah, I really understand your problem, but the focus of our coalition is really on children, school children, you know, and so we really want to kind of stick with that. But let me know if there's something small that I can do to help you. You know, don't say no completely, but don't spend a whole heap of time, you know, on that when you're not working towards what you really want to do. Okay. So please try and decide what your target population is. It's hard to do everything. One other point, when I was working at the community level, we never used the word target because people felt that it's, especially in cities where there is a lot of gun issues, they didn't like the word target. So we used the word intent. We decided that we would change target to intended audience, because you're intending to reach these people. You may or may not reach them, But that is your intention. And I think it's important to set that intention early. Who is it that you really want to reach? Maybe you really want to reach children, but you might have to go through the parents. More than likely, you have to go through the parents. So your intended audience are children of, say, 6 to 11. And then within that, you know that in order to reach those kids, you got to really talk to the parents too. Okay. So I think intended audience covers you best instead of just saying target. I don't like that word target, but some people still use it. So you can decide what you want to do. Let's see. Right. So once you decide on your target audience or your intended audience, you work with those people who are working with those intended audiences. You could, if you know that this particular organization is about to apply for a grant that focuses on the schools, there's actually funds out there now to focus on getting children in the ages, between the ages of 12 and 18 or 19 vaccinated. There's a lot of money out there for that. You may want to work with that organization to, say, implement a community forum around vaccines. You know, that was something we talked about in Diabetes Today. If you decide that you want to, and I'm not sure it's appropriate for every community, but there might be some communities where you need to reach the population, explain to them what a vaccine does, explain to them why it's important for them to get vaccinated, or explain to them why they should wear a mask. A lot of people don't understand this whole situation. And if I know the coalitions, there are coalitions who might want to do that, you know, because I imagine that with the temperature changing, it's going to get colder, there's going to be more COVID. And there might be even more versions of COVID. We now have this version, but the more people who are not vaccinated, the more you're going to have different variations. And, you know, we don't know what's going to happen in the future, but it's so important. And there's money at the state level to implement community-based strategies to reach out to the population so they can understand the importance of vaccination. And I don't know if you've heard recently, there is now data that is saying we can now vaccinate 5 to 12. So that's a whole new population that needs to be reached. But it has not gotten official go-ahead yet from the FDA. By the way, if you want to read up on the vaccines, you can get all of that in the Federal Registry. They had the meeting, they announced the meeting. If you want to make a comment, you can make a comment. There's all this information is in the Federal Registry. It's really a great resource for people who are interested in what our government is doing. Okay, any other questions? Do you see for funding to address those folks that have long? Okay, so there is stuff out there for this. You have to search and find out who in your state is doing this work, Sheila. And there's going to be more funding for that, because right now the government is trying to vaccinate everybody. But for people who actually got COVID, there's several people who are still suffering, even though they had it last year. And there is The NIH is doing some studies on that, but I'm sure there's going to be more coming up. And so if you have a coalition who is interested in working with people who have long COVID, then they should begin to start their search. Now, who Shirley, great idea, Shirley, organizational brochure. What is that? From Sheila? You said great idea, Shirley.
Yes, Shirley made a comment about an organizational brochure, which is a great way to get the word out about your community when there are health fairs and other big events and things like that.
Yeah.
Develop something like that.
Right. And I really think that you'll be surprised how having a skill, being able to implement a health fair, not everybody knows how to do that. And if you're really good at it, you could develop a toolkit for implementing local health fairs. And you could become the expert. A coalition could become an expert on implementing community forums, community health fairs, you know. There's so many things that our coalitions have done that they could actually develop and make money from. So think about all of that. Any other questions? I think I have, oh my gosh, we're over time. Okay.
So we enjoyed you as always, Pat. So thank you so much for being with us.
Yes, and please share the slides with everyone. And I encourage you to go to those sites and read up and just be aware of where the monies are and what you need to do to get some of it.
I'm will also be sharing the recording as well. So we'll send that out as well.
Okay, great.
We posted on our
All right,
YouTube
thank
page.
you.
Okay.
It's
Thank
always
you.
great to see
Thank you,
everyone.
everybody.
Bye-bye now.
Bye.
Thank you.